following video was created by the Protect Parents' Rights team, who is working tirelessly to defend the rights of the people of the state of Illinois and to fully expose the fraud that is occurring related to Illinois state government's response to the COVID-19 pandemic. Since filing a lawsuit against the office of Illinois Governor J.B. Pritzker in order to get full access to the documents Governor Pritzker claimed to have relied on in issuing his original stay-at-home order back in March, the Protect Parents' Rights team has been investigating the validity of this paper titled Window of Opportunity for Mitigation to Prevent Overflow of ICU Capacity in Chicago by COVID-19, which was sent to the office of Governor Pritzker late in the day on March 18, 2020. This paper was produced by two University of Illinois scientists, Dr. Nigel Goldenfeld and Dr. Sergey Maslov. There is no question in my mind that this paper was used to justify the governor's stay-at-home order and was created and advanced for that purpose. Here is proof. On Thursday, March 19, 2020, at 7:26 a.m., the day before Governor Pritzker announced his stay-at-home order, University of Illinois President Tim Killeen sent an email to the government relations staff at the university and CC'd Jesse Ruiz, who is Deputy Governor for Education for the state of Illinois. In this email, which was a forward of Drs. Goldenfeld and Maslov's paper, University of Illinois President Killeen wrote, quote, based on these new epidemiological modeling results attached, the University of Illinois system strongly recommends immediate shelter-in-place or lockdown, end quote. It is worth noting that the University of Illinois has developed and recently began using and marketing a suite of COVID-19 related products, including twice-weekly saliva testing, a contact tracing app, and agent-based modeling. Governor Pritzker is reported to have said, in response to the U of I's rollout of its products, quote, and let me just say to President Killeen, the state of Illinois looks forward to being your biggest customer, end quote. Less than 2 hours after receiving President Killeen's email, Deputy Governor Jesse Ruiz wrote back and said, quote, please know that the governor is working to act on the U of I study and recommendation as quickly as possible, end quote. Clearly, Drs. Goldenfeld and Maslov's paper was used as justification for essentially shutting down the state of Illinois and forcing Illinois residents to stay in their homes. The entire essence of Drs. Goldenfeld and Maslov's paper can be seen in a graph on page 4. This graph represents, and I would argue, totally and very deceptively misrepresents the risk of Chicago hospital ICUs being overwhelmed by COVID-19 patients back in March. And do remember, preventing the overflow of hospitals and ICUs was the main reason that Governor Pritzker gave for his order. The first item to note on this graph is the obvious exponential curve described by the red line, which represents the results of the modeler's simulation without strong mitigation being implemented prior to April 20th, 2020. The modelers state that without the stay-at-home order, the ICU demand on Chicago hospitals would exceed the number of available beds by a factor of about 10, meaning that this is what the modelers were stating was going to happen if the governor waited until mid-April to order all Illinois residents to stay in their homes and only leave for essential reasons in a sort of Wuhan-style lockdown. Aside from the exponential curve, the second item, which is important to note, is the available capacity of ICU beds in Chicago hospitals, which the modelers represented, or as I have stated, I believe misrepresented, at 180 beds. As a result of our extensive investigation, I am of the strong opinion that this graph is the product of intentional and deliberate deception with regard to both the fear-instilling exponential growth curve of COVID-19 positive patients overwhelming Chicago hospital ICUs and the total available capacity of Chicago hospital ICUs. And the Protect Parents' Rights team firmly believes that we have evidence that Drs. Goldenfeld and Maslov had data in their possession that was completely contrary to what they presented in their window of opportunity paper on both of these items. Here are a couple of points that form the foundation of our opinion. The Protect Parents' Rights team has created what we believe to be an accurate recreation of the modeler's simulation. Here is a graph we produced a couple of weeks ago which contains our recreation of the modeler's simulation. We have since made some very minor changes, but I believe and stand by this graph as being quite accurate. In this graph, you see three lines. The black line is the actual 100% valid data of COVID-19 positive patients in Chicago hospital ICUs as reported by the Chicago Department of Public Health. The blue line is our recreation of the modeler's simulation using actual data as a starting point, specifically 18 COVID-19 positive patients in Chicago hospital ICUs on March 18, 2020, a data point referenced in the modeler's window of opportunity paper. The red line is our recreation of the modeler's simulation using the modeler's starting point of 5 COVID-19 positive patients in Chicago hospital ICUs on March 18, 2020. After an extensive search, our team has been unable to find any plausible or factual basis for such a scenario. I believe the reason the modelers made up this completely fictitious and false scenario as their starting point for their simulation is because they knew from their discussions with Rush University Medical Center doctors that their purely theoretical and essentially baseless exponential growth curve of COVID-19 positive patients overwhelming Chicago hospital ICUs was not occurring at Rush and was not going to occur in the city of Chicago. And if they chose to use the actual data as a starting point with their simulation model, within less than 1 week from the beginning of the governor's stay-at-home order, many doctors at the Chicago hospitals would realize that their model was utter garbage, which, as you will shortly see in this video, is pretty much exactly what happened. Reason being, if the modeler's simulation model was correct, the available ICU capacity, which they represented, or as I have said, misrepresented, to be approximately 180 beds, would have been completely overwhelmed prior to the time the stay-at-home order would have slowed the influx of COVID-19 positive patients entering Chicago hospital ICUs. Because there is a lag time from when a person gets exposed to COVID-19 until they develop symptoms that become severe enough to warrant hospitalization or ICU admission. The modelers predicted that the time lag from infection to hospitalization would be approximately 9.9 days. So, the stay-at-home order, which took effect on Saturday, March 21st, 2020, at 5 p.m., would not slow or substantially reduce ICU admissions until around April 1st. That means if their simulation model was correct, the trajectory of our graph's blue line would not change, as in the whole bend the curve talk, until around April 1st. And as you can see from the actual Chicago hospital ICU data, the real numbers on the black line are way below our recreation of the modeler's projections. Which brings us to issue number 2, the issue of available capacity of Chicago hospital ICUs. The modelers said it was approximately 180 and presented that number as a sort of line in the sand. In this graph, we present the actual available capacity of Chicago hospital ICUs, according to the Chicago Department of Public Health, under each date on the graph. Let's look at a couple of dates on the graph that prove the point. March 30th, 2020, and March 31st, 2020. On March 30th, there were 180 COVID-19 positive patients in Chicago hospital ICUs. There should have been approximately 288 according to our model recreation. However, there were still 237 ICU beds available on March 30th, even after accounting for the 180 COVID-19 positive patients in the Chicago hospital ICUs. On March 31st, there were 213 COVID-19 positive patients in the Chicago hospital ICUs. there should have been approximately 338 according to our model recreation. However, there were still 235 ICU beds available on March 31st, even after accounting for the 213 COVID-19 positive patients in the Chicago hospital ICUs. And these examples of the true and factual available capacity in Chicago hospital ICUs do not even include the surge capacity, which is additional ICU capacity. So, even using the numbers generated by using the actual data of 18 COVID-19 positive patients in Chicago hospital ICUs on March 18th as a starting point with our recreation of Drs. Goldenfeld and Maslow's grossly inaccurate and I believe fraudulent simulation model, the Chicago hospital ICU capacity would not have even been overwhelmed until the very last and highest point on this graph, which is on the blue line. It is my strong opinion that the modelers, who are very intelligent and absolute wizards with numbers, knew all of this by March 18th, yet still deceptively allowed their window of opportunity paper to be masqueraded as science. As Governor Pritzker emphatically put it, real, actual science. And if this is not proof enough, our team has recently uncovered additional evidence that even further supports the utter falsity of the modelers' fear-instilling exponential growth curve of COVID-19 positive patients overwhelming Chicago hospital ICUs. According to the CDC, the actual time from exposure until ICU is approximately 14 to 17 days, not 9.9 as the modelers had assumed. Broken down, the CDC says it is, quote, 4 to 5 days from exposure to symptom onset, end quote, and, quote, the median time to ICU admission from the onset of illness or symptoms ranged from 10 to 12 days, end quote. That means, for the most part, the significant slowing of ICU cases would not be expected to be seen on the graph until somewhere around April 4th to April 7th. By then, our recreation of the modeler simulation has the number of COVID-19 positive patients well over 550, going up to around 800 when using the actual data as a starting point. The real numbers of Chicago hospital ICUs are obviously many hundreds lower than that. And keep in mind, Chicago is a city with around 2.7 million people. In my opinion, this is overwhelming evidence of the utter and complete falsity and likely intentional deception put forth as science in the window of opportunity paper written by Governor Pritzker's main COVID-19 modelers, which was created at and advanced by the University of Illinois. But if you are still not convinced, here is a YouTube video with eyewitness testimony by one of the doctors overseeing the intensive care unit at Northwestern Memorial Hospital in Chicago. Let's listen to a couple of clips and take a look at the early April data from Northwestern's ICU that the doctor presents.
This first slide is just some data we pulled from our EDW that kind of shows the growth of COVID cases at Northwestern. So, you know, it started sort of early March was the first documented cases and really started ramping up around the 13th. We currently are right about 130 total patients in-house with COVID infection, and you can see here in this this graph here, the orange line is the growth in the ICU cases that have kind of, we haven't seen the big sort of giant spike. We've just seen sort of slow, steady growth in the number of intensive care unit patients that we've been seeing. So over the first week, again, we saw just sort of a slow, steady growth, and we had a cutoff at about 15 patients is when we activated the second COVID service. So at about, by the 22nd, we had 2 COVID services, which were staffed by an attending, a fellow, and nurse practitioner service, and then some of the resident staff, the senior resident staff that came in. And then, like I said, what we would generally are seeing are early on 4 or 5 admissions for COVID rule-outs. Most of them would end up ruling out and leave the COVID unit, and then we'd end up, retaining 1 or 2 patients and just slow, steady growth until we activated the 3rd COVID unit, which then went on to take over a 2nd floor in the hospital. And then eventually the 4th COVID ICU is now activated, taking over another ICU floor. So I think the Northwestern planning for this was making sure we had appropriate staffing, appropriate location of patients, and sort of a plan in place for the growth. And again, like I said, we didn't see the explosion of cases, that sort of exponential growth yet. We've just seen this slow, steady accumulation of patients.
And I will add, if there were a Chicago hospital ICU where you would see the explosion of cases, that sort of exponential growth, Northwestern Memorial Hospital's ICU would be that ICU, because Northwestern had 11 of the 18 COVID-19 positive ICU patients on March 18, 2020, as stated in the modeler's window of opportunity paper. The other hospital ICU where you would see the explosion of cases, if it were going to occur, would be at Rush University Medical Center, which, as stated in the modeler's paper, had 5 COVID-19 positive patients in its ICU on March 14, 2020. But unlike Northwestern's ICU numbers, Drs. Goldenfeld and Maslov had full access to all Rush ICU numbers prior to completing their paper and sending it to the governor's office. Additionally, by having complete access to Rush's ICU numbers going back to the beginning of March, the modelers clearly knew that their predictions were not occurring in the slightest, and their exponential growth curve assumptions were totally wrong. Here are some excerpts from another YouTube video with one of the Rush University Medical Center doctors who was actually in regular communication with Drs. Goldenfeld and Maslov as they built their simulation model. In this clip, he is explaining exponential growth and why such growth is a real concern for hospitals. But more importantly, be sure to listen to this Rush doctor as he goes on to explain what was really happening in Rush's ICU at the end of March relating to COVID-19 positive patients.
One is called exponential growth. And what exponential growth is, every few days, the number of cases double. And so the actual number increase goes up over time. So if you have 2 cases today, you end up with 4 cases in about 2 to 3 days, is what New York is seeing, for example. Between 2 and 3 days, in the past, they were having doubling of cases. What happens, though, is if that ends up generating really large numbers really quick. So if you have 1,000 cases today, in 2 days, you'll end up with 2,000 cases. And so it's really hard for a hospital to handle huge volumes that increase day after day. There's a second type of growth, which is called quadratic growth. And the name isn't as important, but what it means is the rate of change isn't so fast. It's a little bit slower how quickly things get worse, or how quickly cases increase. So there's early evidence that that we have flattened the curve. And so this is on the left-hand side, these are general medical floors, and on the right-hand side, these are the ICUs. And what you can see is that the yellow line is what we forecast for our exponential growth model, and the red line is what we forecast with our quadratic growth model. And we were kind of rising in our general medical floor beds, but we've just started stabilizing, and we might be declining. And in our ICU bed use, we're still going up, but it's below our forecasts for this polynomial growth. So meaning we're growing, but we're not growing as fast as the worst case scenario. Really, with the time frames, this really does seem like this is the statewide shelter at home taking effect.
Except that, with the time frames, there is absolutely no way it is the statewide shelter at home taking effect, because according to the modeler's lag time estimate of 9.9 days from exposure to hospital, none of the numbers on this screen would have been truly and significantly impacted by the governor's stay-at-home order at this point. And according to the CDC, as I just showed, the actual lag time from exposure to ICU is more like 14 to 17 days. The only conclusion I draw from all this evidence is that there was never, ever, ever a real risk to Chicago hospital ICUs being overwhelmed by COVID-19 patients, and thus there was never, ever, ever a curve that needed to be urgently flattened. People of Illinois, I believe you have been lied to. I think the coronavirus is real and is a serious risk to a very, very small percentage of the population and should be taken seriously by those people. But much of the rest of the messages coming from the governor and the Illinois Department of Public Health are pure and total deception masquerading as science. And the bottom line here is very simple. The University of Illinois, its modelers, and Governor J.B. Pritzker need to face the facts because they have been found out.